Hello, everyone. Myself, Dr. Rohini, welcoming you all for this nice, neat session on common mistakes and commonly asked questions. This is from the brachial plexus formation and supply. So there are so many commonly asked questions, but students do the similar mistakes, common mistakes that they do. I'll tell you what mistakes they do and what are the questions that could come from this particular topic. Also, we are going to discuss. So here it is, brachial plexus formation and supply. So there are some easy methods to remember the brachial plexus. So that also we will discuss. And before that, a small introduction about myself. So I'm Dr. Rohini and I studied at Kasturba Medical College, Mangalore, and this belongs to Manipal Academy of Higher Education. And my additional qualifications in USA and in India include the medical transcription degree and also the administration degree from the USA, that is in hospital administration. And I also have a PhD from Savitha University, Chennai. And I'm also a freelancer. I do ICSI and IVF techniques. Okay, so this is called ART in general. So ART is assisted reproductive technique. And if you are interested in reproductive medicine, this is something that you can consider. So I enjoy my weekends and change of work is always, kind of relaxation for me. And with 10 years of teaching experience, I would like to call myself a good counselor also. I do counsel students who are undergoing this or aspirants of PG NEET exams, FMG, USMLE, PLAB, etc. Because I have seen it all while I was in USA. And I also do counsel students from PhD stream as well. And here is my referral code. You can see there are two codes here. There is ROHINI, and there is also one more ROHINI 10. So you can use either one of them. And why do you need the code? You need the code because you want to access the free products. We have a lot of free products. We have free products in the form of the special classes, quizzes, and so many tests. So all this you can access with the help of this unlock code or the referral code. So try this today. It is my name itself, ROHINI, and you can also try with this code, ROHINI 10. So both of them work equally well. Please try. You can also get this 10% discount when you go for subscription classes like the plus class or the iconic classes. And here is the topic, brachial plexus and the nerves emerging from it. Here we have this. Now, brachial plexus, do we have cervical plexus? Yes. Do we have brachial plexus? Of course, we do have. But do we have thoracic? No, we don't have. So the plexus from T2 to T12 is not formed. This is one common mistake that students do. They end up saying there is thoracic plexus also, but there is no plexus formed between these segments, that is T2 to T12. Keep this in mind, no plexus. And of course, there is lumbar plexus and then there is sacral and coccygeal plexus. So this is important. Next, let's see what we have here. We have brachial plexus format. Now, how is it formed? You can see first it starts with the roots, then trunks, then there is divisions, then the cords and the branches. There was a question I saw somewhere. They would just jump in a hurry and they would say, yes, this is the right answer. But the question was, what was the question? The question was, trunks are present in axilla, yes or no? Are the trunks present in the axilla? Yes or no? The trunks are not present in the axilla. The trunks are not present in the axilla. It's only the branches that are in the axilla region. So you must remember that's a false statement. Okay. So when the moment they see the brachial plexus, they think all of it is present in the axilla. It is not so. It is only the branches part that lies in the axilla region. Rest of them are in the neck itself. So you have roots, trunks, divisions, which divides into anterior and posterior divisions. Then you have the cords, and then comes the branches. Now let's see, there is C5, C6 root, giving rise to superior trunk. It's also called the upper trunk. And then comes the C7, middle trunk, and then C8 and T1, inferior trunk. So these are the trunks. Now here you must remember, if C4 is involved, it is called prefixed. If T2 is involved, it is called postfixed. All right. So the trunk, upper trunk is associated with the Erb's palsy. And the inferior one, or the lower trunk, is associated with the Klumpke palsy. So you remember Klumpke monkey. There is a line which says the Klumpke monkey was hanging down from the brachial plexus. So that is one thing you can see. And there is this divisions. There is an anterior division and there is a posterior division. Similarly, there is an anterior division and a posterior division. These are all posterior divisions. The one which is in black is anterior division. So here there is anterior, here there is anterior, and here there is anterior. These anterior divisions, see what they give rise to. Anterior division would give rise to the lateral cord, and then it gives rise to musculocutaneous nerve. So lateral cord gives rise to musculocutaneous. Similarly, you have the middle trunk giving rise to the median nerve. So you have the middle, and then it forms the posterior cord. And posterior cord, how it is formed? By joining of the posterior divisions of all these three trunks. So you have, there is one joining here, another one here, and you have the final posterior cord. And posterior cord gives rise to two nerves. One is the axillary, the other one is the radial. So these are the two nerves that you can get from the posterior. All right, so this is one important thing. Always people get confused between posterior and inferior. So they'll think this one is this one. No. Posterior cord is different and inferior trunk is different. Don't get confused between the cords and the trunks. The trunk comes first, then the cords. And then you have the medial, and that gives rise to the ulnar. So remember all these in an order. And you can just remember this in a very neat manner. I'll tell you how. You can remember this as, are you tired? Drink. Okay, coffee. Buddy. What is R? R is for roots. And then we have trunks, divisions, then you have cords, and then the branches. All right. So that is how you remember the sequence. And then here you have the C5, C6, C7, C8, and T1. The diagram is shifted, so it could be like this also. So don't get confused. And let's see what are the nerves that arise from the upper one. You have the suprascapular nerve to subclavius. You have dorsal scapular, all scapular region nerves. So you can see the three things. And then you have the middle one. Then comes the lower one. So long thoracic nerve, this is one important nerve. This has the root value C5, C6, C7. And this supplies the serratus anterior. So it starts from the root itself. You have this long thoracic nerve arising from C5, C6, C7. So very, very important. Okay, it is same as the musculocutaneous nerve. The root value is same as the musculocutaneous nerve. So here you have the anterior division. It gives rise to the lateral cord here, and you have lateral pectoral nerve. And then there is this middle one, and you can see all these posterior cord divisions. You have the axillary, radial, of course you have thoracodorsal nerve as well. And then you have this median nerve formed by lateral and the medial head. Okay, lateral and the medial head from the upper and the lower trunks. And then you also have the lower trunk giving rise to so many other nerves other than the ulnar. So ulnar, you have C8, T1 as the root value. Then you also have medial cutaneous nerve and medial pectoral nerves. So these are the branches. Okay, these are the branches coming from the main trunks. All right, so now here let's list them. You have MLL here, and then you have 4 times M, and then you have U here. I have a mnemonic for this. And then you also have from posterior cord, you have the ulnar, ULNAR, ulnar. Okay, you have this. So let's see what we have here. You have lateral cord. The mnemonic you can remember this, Lucy loves me. Okay, it's very simple. Lateral pectoral, lateral root of median, and musculocutaneous. And then you have medial cord. Then you have your most medical men use morphine. Okay, so you can put something else if you don't like that word. So you can say medial cutaneous nerve of the arm, then of the forearm, then you have pectoral nerve, then you have important one, ulnar you have from the medial cord, then medial root of median. That also comes with the lateral node. Together they form the median nerve. Then you have the posterior cord giving rise to the ulnar. So you have upper subscapular, lower subscapular, then nerve to latissimus dorsi, very important. Okay, nerve to latissimus dorsi is from the posterior cord. And then you have axillary and radial. So this is how you can remember it. And what do they supply? Now, we mentioned so many branches, so many divisions, and so many branches, but what do they supply? Now, let's take up some important ones. We have the dorsal scapular, then we have suprascapular, and let's see long thoracic. This is important. Long thoracic is from the C5, C6, C7. What does it supply? It supplies the serratus anterior muscle. Very, very important. Very, very important. And then you also have this the medial cutaneous nerve of the forearm, then medial brachial cutaneous nerve that is in the arm, and then you have upper subscapular, this one, and then you have the lower subscapular. They all supply the name of that muscle itself. So you can recall the muscle. So you have subscapularis, then you have subscapularis and teres major, and then you also have thoracodorsal that supplies the latissimus dorsi. So these are some of the nerves and their supply or innervation. Next, coming to the easy method to remember those sequence. I mentioned it just now, really tired, drink coffee buddy. So this way you can remember ventral rami. Ventral rami are the ones which take part in the brachial plexus because they supply those motor roots. Okay, so we have this roots, we have trunks, divisions, cords, and branches. We have all this, and then let's see. We have all of them passing under the clavicle. So it goes under the clavicle just above the first rib. First rib would be here, and the second rib would be here. And this is for the second one, and this is for the first one. Okay, so between these two, you can see the plexus of, biceps. Now here you have the musculocutaneous, median, and the ulnar nerves. How are they formed? Now I want to tell you the root value of them. The musculocutaneous has C5, C6, C7. If I just tell you like this, how would you remember? It would be difficult for you to remember, right? So you remember it this way. Median nerve has all the roots. It has from C5, C6, C7, C8, and T1. You just remove the first three. You will get the root value of musculocutaneous. And you remove the last two, you get the root value of ulnar. So just sliding, okay, just slide it off. and you will get the root value of these. What is the musculocutaneous supply? Does it supply anything in the shoulder region? Not much, actually, just the coracobrachialis. Then there is one more muscle it supplies, biceps and the brachialis. These are the arm muscles. These are the flexors of the arm. Next, we have the median nerve. Median nerve does not supply anything in this region. It does not supply anything in the arm region as well. It goes to the front of the arm. It supplies everything in the forearm except one muscle that is called flexor carpi ulnaris. That is supplied by the ulnar nerve and not the median nerve. Okay. So you have that flexor carpi ulnaris and half of another muscle. This half is supplied by this side. This half is supplied by the other side. So one half is supplied by median and the other half is supplied by the ulnar. So that's how the supply it is. So this muscle is also called the hybrid muscle because it has dual nerve supply. And they also have all these branches going to those intraossei, lumbricals, etc. So that's the beauty of this median nerve and the ulnar nerve. So let's see what the median nerve does in the hand. So here median nerve, you can see it LOFT, loft muscles it supplies. Okay, you have the thenar muscles, lumbricals. You can see thenars and the lumbricals. That is 2 and 3. You can see and thenars, all the three are there. There is opponents and there is flexor, opponents and abductor. All the three are there in this group. That is thenar muscles. And then there is this ulnar nerve. And what does ulnar supply? It doesn't supply loft muscles, but it supplies the other muscles like the hypothenar muscles. And then you have the intraossei. There is 4 plus 3 intraossei. And you also have the lumbricals, that is 4 and 5. So this is the supply in the hand region. And it is very sensory also. It is both sensory as well as the motor. It is sensory to 1.5 fingers here, ulnar. And this one, median, is sensory to 3.5 fingers. So remember this. This is very useful whenever there is this condition called carpal tunnel syndrome and the person will have pins and needles feeling in his 3.5 fingers region. And that indicates that there is a compression of the median nerve. So this is why ulnar and median nerve supply is very important to note down. And next, coming to the radial side. Radial, you have radial nerve, all of them are the root values. So now you have C5, C6, C7, C8 and T1. They're all the root value of radial. Then you also have axillary, is C5, C6. So here you have all of them. Does it supply anything in the shoulder? No. Then you have the triceps. Then you have everything on the extensor compartment. This is extensor compartment. Everything is supplied in the extensor compartment. All right. So that is radial nerve. So you can see the back side of the, actually we can remove this anterior view. We don't want, we want to show the posterior view. Okay. So this side is radial. So here only sensory is given, but I'm talking about the motor. Here the sensory is given as a diagram, motor is given as words. So here you can see variable contributions are there from other muscles also. And you have axillary supplies two muscles, teres minor and the deltoid. And you can also see that it is sensory to regimental badge area here. So this much, that is lower 1/3 of the deltoid region. So that is cutaneous innervation and that side is muscular innervation. How neat the diagrams are. When you study with the aid of mnemonics, it becomes very easy to recall. So now here we have, and Okay, here I also have some more things like the quick information about the Unacademy. We have special class features. What is the special class features? Special class features are very different from the usual YouTube classes. How different it is? Because special class is more interactive than the YouTube classes. And because you have a group of students, you know that these group of students have attended, you get the numbers, you get to see their names, and there itself, they can ask you questions and clarify, and they do interact a lot. And one more thing, benefit for the student is they can raise a hand and ask a question. And also the lecture notes are available, while it is not available in case of YouTube classes. And in the YouTube, you feel like a small fish in a big ocean where you're a little lost. You don't know whether it is going in the proper curriculum or not. Is it some part of a small topic or a big topic? Nothing you know of. But in case of special classes, you do get the lecture notes, you do have a curriculum, everything is intimated ahead of time. You will get a notification so that you don't miss a class. So, with all these, who wouldn't get motivated? Anybody would get motivated, right? And you can also access this anywhere and anytime. So, that is one new feature of this nice special class. And we also have so many upcoming recorded special classes and also some of the live classes. Mine would be at 5 p.m. So please look for this time, 5 p.m. This is when I'm just there and I conduct those special classes with my, students who always look forward for my classes, and you be part of the class. And this is like an open invitation for all those who want to experience the feel of the special class must log in at 5 p.m. and look forward for these classes. I cover a lot of things like MCQs, image-based questions, and I also cover some key concepts in anatomy. And this is the plus subscription where you can access both live and recorded sessions, and you can also learn from top educators, and you can study on the device of your choice. All these things are there because the app can download to any device. It's not restricted to only some devices. And we are also going to have something that is coming up, that is printed notes with the 12-month subscription. So you want to have notes, go ahead with the 12-month subscription. And you also have this iconic subscription where you have the Unacademy and the Prep Ladder Club together. That is iconic subscription. You also have this NEET PG 1 month package as well, where you can go with this ultra fast track, high yield revision batch, and emergency room MCQs are there, and PG test and analysis batch. All this, what is this? It is all scheduled ahead of time. So look up your calendar, mark it off, then you're good to go. So that full 1 month package, you can prepare and you can answer those questions, you can discuss as well. And here the batch is starting on 11th of August, where Focus FMG batch, NEET PG test and analysis batch, Target NEET, next 2022, and NEET PG Ultra Fast Track High Yield Revision Test. All these are available at only Unacademy platform. And you can also see there is a big lineup of the grant test series. You can see it starts on 7th of August and goes on till September 9th. Okay, that is grant test series. It is already scheduled. So you know the time, 9 a.m. to 12 p.m. and you can work around the time. And you can also see that 1 month package is put up there. And you can also see there is a Med Genius scholarship test where the one who is a genius would get something really nice. How many questions? 50 questions. Who can participate? NEET aspirants. It's a free test. You don't have to pay. It is on 14th of August at 8 p.m. and it is 1 hour test, and your knowledge and all that will be really, really, rewarded by Unacademy plus subscription. So that is what you're going to get. So there is number based questions, numerical questions. You can answer them. I'm sure if you're prepared well, you can answer them. There is FMGE, Focus FMGE batch. There is Target Next 2022. All these are running parallelly for your benefit only. And you can also see NEET PG test and analysis batch, and also ultra fast track high yield topic revisions are done. All this comes with the PDF notes. So you are not going to miss the notes. In case you have missed the class, you have the notes available for you. And recorded sessions, of course, are available. Once you have subscribed, you have access to many things. And if you're still under UG and you don't understand whole lot, you want to wait and have a firm foundation for your goal towards the PG seat, then please go with the 4-year subscription, and that is 60,000 for plus subscription and 75 with the iconic. That can be done, and you can have a firm foundation for your NEET PG exams. And there is also, we are launching 6750, launching 2-month subscription price. This is, and it is just introductory offer, so it may go up again. There is limited time offer 92 slash to 58,500, and that is for 36-month subscription. Similarly, there are so many price slashes. You have up to 10% discount. Okay, all that you can avail by using the code. Use my name as the code, please. And you can see there is a hike in the price. Just 5th was the last day. There is a slight hike. You can please go visit the website and see if there is any other offer from our side still left. And there is a raise a hand feature where the students would raise a hand and ask a question to the educator, and the educator would be answering the question then and there in the class itself. You also see fast mile to NEET PG 21. You also see integrated clinical batches, and you can also see Focus FMG batch where you have about 650 hours of duration given to them. And you can also see the best of all, the EMI option. When you feel the amount is little too much, why don't you go with the EMI option? Go with this. Per month, you're spending only 1,120 or 1,250, and that is for plus, and then iconic will be little higher, 1,406. So that is something that is really interesting, right? And all this can come for you when you use the code ROHINI. So please do use the code wherever prompted, okay? And this is for all those who have been patiently watching and understanding what exactly I'm trying to convey. And this is, please subscribe and like all my classes. I'm not familiar with some of the streams like FMGE students and INSCET students. And if you subscribe and hit a like on my classes, I'll be involved even more with your courses. So this is from my side. A big thank you, and use the referral code whenever you want to subscribe. And please follow me. All those who don't know me, first follow me. Okay, that way we get to know each other, and we can really build a nice, learner and educator relationship. Thanks to all of you for watching this, and you have a very good day ahead.